Picture this, you're a family doctor entering the clinic for a busy morning of patients. You meet your first patient, 7-year-old Samir, who tells you that he's been coughing and sneezing. You initially hypothesize that he has allergies. So you ask confirmation questions such as whether he also has a runny nose and watery eyes. His mother informs you, however, that he's never had seasonal allergies in the past and that his symptoms only started a couple of days ago. However, you dismiss this information and conclude that Samir has seasonal allergies. A week later, however, you learn that he in fact did not have seasonal allergies, but rather had the flu. But because you didn't listen to the mother's comments because they went against your initial hypothesis, you missed this diagnosis. So what happened here is called confirmation bias. It's where we seek information that supports our hypothesis while ignoring evidence that goes against it. There was a study done where psychiatrists were given the description of symptoms for a condition and then told to make a preliminary diagnosis. After that, some of them had to go and conduct a confirmatory evidence search, while others conducted a disconfirmatory evidence search. They found that psychiatrists who conducted the confirmatory evidence search, so a search that would confirm their preliminary diagnosis, were more likely to make errors than psychiatrists that conducted a disconfirmatory evidence search. Moving on to your next patient, you walk into the room and you meet Christopher, who is laying on his side, his breath smells like alcohol, he has slurred speech, and the nurse reported that he has uneven gait. This leads you to believe that he is inebriated. However, after a second doctor takes a look, it is determined that he actually suffered from a stroke. So what happened here is that the contextual information of breath smelling like alcohol led you to believe that the reason for his clinic visit was that he was intoxicated, because this fit the description of someone who had been drinking. So this is an example of representative heuristic, which is where we make a decision based on the belief that the example belongs to a larger representative category. So the previous scenario was actually used in a study where nurses read the description of symptoms of a stroke. In some descriptions, there was the mention of breath smelling like alcohol, whereas in other descriptions, there was not this mention of breath smelling like alcohol. The results showed that nurses who read the description that mentioned that the breath smelled like alcohol were less likely to attribute these symptoms to an actual physical cause compared to nurses who read the same description but without the mention of the breath smelling like alcohol. So here the contextual information influenced the medical diagnosis. Nurses who received that contextual information of breath smelling like alcohol likely believed that the patient belonged to this larger representative category, which is that of people who had been drinking alcohol. Finally, you move on to your third patient, Maria, and she is presenting with the following symptoms: cough, fever, high temperature, and chest pain. You recall that yesterday you also had 3 patients with the same symptoms who were subsequently diagnosed with pneumonia. So pneumonia comes readily to your mind and you diagnose Maria with this condition accurately. And so this is an example of the availability heuristic, which is where we make a decision based on the most readily available information. In a study where physicians were diagnosing bacteremia, which is a condition where there's bacteria in the blood, they found that patients of physicians who had a recollection of frequently diagnosing bacteremia were more likely to be diagnosed with bacteremia compared to patients of physicians who did not have this recollection of frequently diagnosing bacteremia. And so here, the diagnosis of physicians was influenced by how readily and how quickly memories of diagnosing and treating bacteremic patients came to mind. So to conclude, I'd like to go over a couple takeaways for future healthcare workers regarding these heuristics. So number 1, consider information that goes against your preliminary diagnosis and be aware of alternative hypotheses. Number 2, be aware of base rates in the absence of situational information. Number 3, consider whether salient information simply reflects recent or memorable experiences. And finally, although efficient, remember that biases can lead to errors. So we want to remember that using heuristics do allow us to make these useful decisions, however, they can lead to errors. Thank you.